Now, my take on the day's news. Now, some of the people who need to heed the message that they've just heard from the Prime Minister about the need to stay the course and potentially calm down a little bit are some of the people who understandably are dealing with a lot, but they're also under a lot of pressure. The truth is that we live in a democracy, and that means even when government makes decisions that we vehemently disagree with, we are allowed to disagree with the decisions that they have made. No doubt there'll be people who will disagree with the decisions that have just been made by National Cabinet. But the gold standard government in New South Wales is fast becoming the tin standard when it comes to their courage to be able to accept observation or criticism. I point firstly to the health hazard, Brad Hazzard, the Health Minister in New South Wales.
I mean, you guys can all be instant experts, but you're journalists, you're not epidemiologists. We take our advice from the health authorities, and the advice that we were following was exactly what we were required to do. And of course, the issue then is that, unfortunately, as I said, you can't regulate for stupidity.
Now, that bloke is a guy who has a glass jaw and very thin skin. So I was somewhat surprised when Gladys Berejiklian effectively echoed that sentiment at a press conference today. Put simply, ignore everyone else, just listen to the government, because we're the government and the government is the government.
Everybody has an opinion. There are a lot of experts out there giving their opinion on what may or may not be the case. Please know that what has served New South Wales very well is that we've relied on the health expert advice of Dr. Chant and her team.
You are allowed to question your government. You are allowed not just to have an opinion, but to use the information that is provided to us, yes, by government, to form a view about whether we are doing the right thing or not. It is not the only way that the rest of the world is handling things, and as you've heard multiple times, there are other places in the world that are similar in size to a nation like ours that are dealing with it differently. But the panic merchants, well, they were everywhere today, no matter who they are, running a state with anything from 18 to 0 cases today.
Seen what can happen when this variant is left to spread unchecked in the community. It's essential that everyone remains vigilant. Government, businesses and the public.
But the alternative is the potential for a full-scale lockdown in South Australia. We don't want a lockdown. We've got to take action.
The reality is we are not out of the woods yet, not by a long way.
We start seeing any spread of community transmission in New South Wales, especially closer to our border, we will not hesitate to take strong action.
Now, here's the thing. I've always argued about proportionality. I've argued that for the whole time. I've given praise and I've thrown brickbats at people who fail to see the proportionality. You see, we now know, the best part of 18 months into this, that not every case is going to equal death. In fact, 99% of everyone who contracts coronavirus mightn't have a pleasant experience, but they're not going to die from it. We know that the most vulnerable populations are people over the age of 70 or people who have comorbidities, people who would be crook for a lot of other different reasons, and COVID could push them over the edge with their immune system. That's what I've talked about the whole way through. Yet, the assumption, the panic that seems to exist now is that every case equals imminent death, when there is no evidence to suggest that's the case. Is there currently a spread of extra cases around Australia? You betcha. But wait till I show you the numbers about the actual number of people who are seriously ill right now as a result of this. Remember, every time I show you these numbers, we are a country of 25 million people, and not every case is going to equal hospital, and not every hospitalisation is going to equal ICU, and not every ICU is going to equal death. We dealt with this last year. The reason we ended up with hundreds of people dying was because of the failures in and around hotel quarantine in Victoria that got into aged care in Victoria. There were no mass deaths in aged care in any other state. So this system that we currently have, while imperfect because human beings are involved, is effectively working. But the panic, in my view, is unnecessary. And I know that that's seditious to the Health Minister of New South Wales, but bugger it. I will exercise my free speech. I will exercise my right to have an informed opinion and inform you of that opinion each and every night. The governor of Singapore has taken a new position, which is they're not going to talk about cases, they're not going to talk about contact sites, they're only going to talk about the numbers that end up in hospital. They have made that transition. It's a transition that I think Australia should be getting to, because by this point in time, we know we're not dealing with the blob. We know about proportionality. The Health Minister in Singapore has said that every year many people catch the flu. The overwhelming majority recover without needing to be hospitalised with little or no medication. But a minority, especially the elderly or those with comorbidities, can get very ill and some succumb. We can't eradicate it, but we can turn the pandemic into something much less threatening, like influenza, chickenpox, and get on with our lives. So here are the numbers that you did not hear on the 6pm news, that none of the clickbait websites are interested in reporting, but I will tell you these every night from here on in. According to the Health Department at the federal level, there is just one person in ICU in the entire country. They are in New South Wales and they are not on a ventilator. The total number of people in hospital across the entire country is 54. There are 40 people in hospital that have all come from hotel quarantine who are in Queensland. 7 are in the Northern Territory, 5 are in New South Wales, including the one person in ICU who's not on a ventilator, and 2 people in Victoria. Now think about the potential, inevitable, apparent lockdown that might be on its way to Brisbane, the lockdown that is currently in place in New South Wales and parts of the Northern Territory. And then look at what happened in Queensland in the past 24 hours when 40 people were in hospital. Nothing. 50,000 people were able to go to the football. Millions of others were able to freely move amongst their homes, go to pubs and all the rest of it. This is proportionality from the very same government that is trying to threaten an instant lockdown because of a couple of cases that might well be in the community. And again, Gladys Berejiklian seems to have reverted back to where she was 12 months ago, where we're apparently fighting the blob. Remember, there is a difference between the number of places that people have gone versus the number of people who get tested versus the number of people who get sick versus the number of people who end up in hospital versus the number of people who end up in ICU versus the number of people who have died. Here is Gladys Berejiklian.
We also have to be prepared for the numbers to go up considerably because as experience shows with this strain, we are seeing almost 100% of transmission within households and we're seeing a very high rate of transmissibility.
And again, is this thing racing through the community in New South Wales? Well, I'll let you decide based off the numbers that they give us every day. I have my view. I've made it very clear to this point. There are 131 active cases right now in New South Wales. Almost 500,000 people have been tested. And once you put that through your computer, you can work out it is 0.028% of everyone who went and got a test because they felt crook, they knew someone who was crook, they went to one of the places that a crook person had gone, but 0.028 of them ended up having COVID, of which 5 have ended up in hospital, 1 is in ICU and does not need a ventilator.